we on? Good morning, everyone. Welcome to our panel on doctoring up your social media advocacy. My name is Mike Blonde. I'm from Hootsuite in Vancouver, Canada. We're really excited, the panelists and myself, as your moderator, to talk to you folks for the next hour or so on social media healthcare advocacy in the healthcare space. Format for the next 35 or 40 minutes is quickly the four of us will give an intro, and then I'll put these guys on the hot seat with some questions on their social media advocacy programs. And then we'll have a good 15 or 20 minutes for question and answer, so please keep your questions to the end, but jump up to the microphone here and we'll go through them. So without further ado, I am so pleased and honored to be hosting two world-class brands, both Baylor, Scott & White Health here in Austin and around Texas, and of course Mayo Clinic, Lee joining us from Rochester, Minnesota. Both of these brands are on their way to building some fantastic employee advocacy programs, both from a physician and healthcare provider perspective, but also within the employee base more broadly. And the result of which is some really exciting marketing opportunity in terms of brand awareness, but then also employee advocacy as well. So as mentioned, my name is Mike Blonde. I'm the Director of Growth Strategy for the enterprise business at Hootsuite. Those not familiar with Hootsuite, we are a technology company headquartered in Vancouver, Canada, focusing in the social media management space. For me, this is my sixth South by, really excited to be back. So let's just center us a little bit around brand advocacy for a moment, and the opportunity that healthcare leaders in the marketing department get excited about when engaging and kind of lighting up their employees within a social media kind of perspective is three big opportunities that they're excited about. One is more engagement. So 8 times more engagement of employees sharing content compared to the brand sharing content. So Jacob, remind me, how many employees Baylor, Scott & White?
Just over 44,000.
And Lee, how many employees at Mayo Clinic?
64,000.
So clearly a huge potential to generate better engagement when it's authentic employees sharing messages from either Baylor, Scott & White Health or Mayo Clinic. 92% of an employee's brand followers are new. So that, for example, if Dr. Clark is going to be sharing out content and her network of colleagues or network of friends perhaps start engaging with the Baylor, Scott & White Health brand, huge opportunity there. And then also a 24 times reach of that employee base sharing compared to the brand. So this is kind of what's top of mind for the marketers. If we turn to perhaps folks in human resources, what they get excited about, what's kind of top of mind for them, is 20% more likely to stay at their company. So those employees, those physicians that are actually engaging in social media activities on behalf of the brand, we're seeing huge results in terms of increase in Net Promoter Score, longer tenure at the company, other aspects in just terms of being more satisfied in their day-to-day. And then finally, 27% more optimistic about the company's future. So this could be, connecting to the CEO's vision, could be better aligned to the company's core values and the culture. These are all, positive benefits, huge opportunities that are, I'd say not just top of mind for HR leaders, but also the executive team as well. Just a quick little snapshot of kind of dog fooding, if you will. So this is results of Hootsuite's our own advocacy program in 2016. So we've got approximately 900 employees around the world. You can see the results of what we've been able to accomplish. So just over 600 Hootsuite employees. That's about it's a 73% adoption rate. If you take a look at the actual traffic to website, so there's more people going to the website. They're downloading white papers, they're requesting demos, they're looking to get questions answered. All of the results that you're seeing is purely from the Hootsuite employee base sharing out our branded content. So just a snapshot of kind of the art of possible. So that's a little bit of kind of the context that I wanted to set, and love to turn things over to Dr. Clark to give a bit of an intro.
Hi, I'm Skye Clark. I'll keep this very brief. I'm a family medicine doctor with Baylor, Scott & White. Currently, I'm the supervising physician of our brand new Austin downtown clinic. That's kind of serving as our tech hub. So we're using the clinic for full primary care, but also to try to identify kind of tech-forward ways that we can better reach our patients, better communicate with our patients. So even within the clinic, we have Surface Pro check-in. We have kind of these new display boards in each room so that patients can actually see what I'm doing on their electronic medical records. They can see their vitals. I can kind of graph their labs over time. We're trying new ways to meet our patients, so we're trying out e-visits and video visits, and then we've recently launched a program. It's kind of like a new school take on old school house calls. So it's via an app called Pager. You push it and get in touch with a nurse, and then right away we could send out one of our providers to the patient at their home, their hotel, park, whatever. So because I'm kind of working in this capacity, I was approached by our company and asked if I would kind of undergo this social media training for physicians. So I'm kind of one of the guinea pigs, so I'll just be talking about kind of what that's been like and what we hope to do with it moving forward.
Awesome, thank you.
Great. My name is Lee Acey. I'm the director of the Mayo Clinic Social Media Network, which I think is kind of a cool thing that we would have such a thing named like that. But Mayo Clinic really has social networking in our DNA. Our founders, the Mayo brothers, Dr. Will and Dr. Charlie, had this amazing commitment to outreach. I mean, they came out of age in the golden age of surgery when anesthetics, better anesthetics allowed more complex operations. And so they really found it important to go out and travel, to learn from others, to see what, as the technology, as the techniques were expanding around the world. Dr. Will traveled to 25 countries, including Australia, New Zealand, Russia, Sweden, lots of places in South America, to bring back what he was, what was being practiced at other places to Rochester, Minnesota. And in addition, between 1908 and 1918, they welcomed about 3,400 physicians to come watch them operate, and so there was this great interchange. And so the big picture thing I'd like you to remember is that there's really a lot more continuity between social media and traditional communications than what you might really understand or what you might perceive. In fact, I'd just say that traditional communications are to social media as surgery is to the Da Vinci robot, or as walking is to driving a car. So for all of these things, it's important to have training. It's important to have, you don't just jump right in and start driving a car, and thankfully none of my children have done that. They got training first. And so that's what we've worked is to develop, building on this continuity between Mayo Clinic's history in terms of how people have always found out about us for 150 years. How do we translate that into the digital age? And so given the fact that our folks are, everybody who's a physician is an A student, fundamentally an A student. They don't want to look dumb in public. And so we want to give them the training and the tools so that they can quickly get into being able to use these tools well. And so that's what we've all been about. We've developed in collaboration 3 years ago, just before South by. I met with Michael and we decided to work together on a CME accredited program to help physicians be able to get engaged in social. That way they don't, it's one thing, if you don't have them fundamentally have a baseline of being involved in social, the fact that they're sharing content doesn't matter because they don't have any followers or friends anyway. So we need to get them comfortable first, and that's what we've been working on. And we do have our own plan for, that we call our Social Media Champions program. It's connected with our online patient-to-patient community. We want to get our staff involved there, providing expert content and commentary, and also just supporting that community effort that we have.
Hi, I'm Jacob Sloan. I'm the Director of External Digital Communications and Social Media at Baylor Scott & White. We kind of, if you're not familiar with Baylor, we're the largest healthcare system in the state of Texas, and like we were saying earlier, have a little bit over 44,000 employees distributed throughout the state. We actually, in the last year, also onboarded what we're calling the Social Media Leadership Academy. We worked with Hootsuite and Mayo to adapt the lesson that Mayo had created and make it available for our physicians to just kind of have 0 to 60 on how to be involved in social media. And in addition to that, we've onboarded an Employeeabbacy app in a partnership with Hootsuite to really increase the internal communications within our organization across all of our network, and then to also really help our physicians kind of have some training wheels as they get into the social media space.
Perfect. Nicely done, guys. We're on time so far. So before I put these guys on the hot seat, love to just get a sense of who's in the room, maybe by a show of hands. So hands up, show of hands if you are in the healthcare sector. Wow. Show of hands if you are perhaps in technology or media, work for a media company. Okay. And then maybe show of hands if you're in the agency space. Okay, good. So a good mix. Okay, let's talk a little bit about the landscape then, today. And maybe first question for you, Dr. Clark, is how, your view of social media's role in healthcare today. I know you're, newer. You kind of talked about being the guinea pig for this new program, but just love kind of your thoughts on the opportunity that social has for healthcare.
Yeah, so this has been really interesting for me. I don't know if there's other physicians in here, but generally as physicians, we are taught early kind of to stay away from social media. At least in my training, it was, you really need to protect your online presence. When I came from a background in the arts where I was all over social media, and then once I decided to go into medicine, I was told to hide that, to change my username so people couldn't search for me. And so I still have remained active on social media, but I never identified anything with my company. I definitely didn't friend any of my patients or anything like that. So it's been really interesting to have my company, who I work for, who is a very well-respected healthcare system, be forward-thinking enough to kind of approach me and say, let's do this, and let's do it the right way, and kind of give me the training so that I can engage patients and engage colleagues on social media. I am having to fight my own instincts just because it's been so kind of embedded in the way I think that I need to kind of keep a distance between myself and patients. But what I realize is, when patients come into the room, they're on their phones, they're living in kind of the realm of social media, and if I want to reach them, and I'm a preventative care doc, I do family medicine, so if I want to reach them and I want to reach them early, then I need to embrace wherever it is that they're going for information. So I think there's huge opportunity for this. I'm really excited about it. It adds kind of a fun element to my day that I wasn't doing before, and now it's legit. It's not like I have to hide it from people I'm working with. So yeah, I'm excited about it.
And Lee, anything, what's kind of your, it's 2017, you guys have been at this for a while. What's sort of the landscape today at Mayo Clinic relative to the physician's perspective of social media?
Well, I think what's really changed, so we have a medical director for our Mayo Clinic social media network, Dr. Ferris Tamimi, who's a cardiologist. I think he would say that the change has been that it used to be that there was a lot of skepticism among the physicians as to whether this was worthwhile or whether they should be involved. And now he's not having to make the argument. He's not like fighting them off or anything like that, but in terms of them wanting to engage. But they're very much more open to it, and he's getting asked to come to department division meetings and say, so, hey, we think we should have a Facebook page. Okay, so that's just like, okay, that's kind of like when people come into the doctor's office with their printouts in terms of saying, I think I need, doc, I think I got this. And it does at least open up the conversations. We've got a lot more openness to saying, how should we smartly, strategically be able to use these tools? And it's just been a really welcome growth, I think.
And Jacob, have there been any kind of light bulb moments, or again, where there's been an organic story, something shared, anything that kind of helped you, make the case to make an investment in programs and technology?
Yeah, I think for us, really, a lot of the light bulb moments happened in the way our patients were interacting with us as a brand. We'd had a social media program really going since 2009, and there'd always been a little bit of interaction. We have some patients who, every year on their cancer anniversary, will send a thank you to the brand, and we started sort of routing that in internally. We had people reaching out without even hitting a nurse's call button or anything like that their IV had fallen out or that they missed a meal inside a facility. So it really started to permeate a lot of the operations of the company. And then I think, like Lee was saying, I think in the last year, really especially, it's flipped to where instead of going and trying to dig these stories out of our physicians, we have a lot of of groups and service lines who are very interested in being a part of social and very interested in getting it out there, and it's all about kind of directing that energy into the right place and in the right way.
Mm-hmm. And you know, Lee, I think just in terms, you had shared a story in our panel prep about the face transplant. That was a really cool story that we should, you know, folks in the room might not know about, in terms of, you know, just completely blew away the reach and the expectations that your team had.
Yeah, we just had, in early February, I think it was, well, anyway, early February, we announced and introduced the first patient who had a face transplant at Mayo Clinic, which was something that was, and so if you just Google face transplant Mayo Clinic, you'll find it. Really amazing story. We were seeing 1,000 shares per hour with this story on Facebook, and it reaches about 25 million, about 9.5 million views. They're the 3-second views on Facebook, but you know, something like 4 or 5 million 10-second views, so really making an impact. Social's been really helpful for us because the patient wanted to tell his story. He had tried to commit suicide 10 years ago with a shotgun and had failed, thankfully, but had significant deformities because of that. And when we developed the face transplant program, he had been at Mayo Clinic for some reconstructive surgery previously. We saw him as a great candidate for this. But he also wanted to, he wanted to blend in. He wanted to tell a story. He felt an obligation to share his story about how this had given him a new lease on life, that kids weren't scared of him anymore. You know, that he could walk down the street and people would not pay attention to and point. So he was wanting to do that, but he also didn't want to do it in a way that would, like, he'd be on the Today Show and he'd be doing a series of media interviews. So through social, we were able to give that big amplification. And we didn't actually do that much in terms of amplification. It was just the kind of thing, a great story sort of trumps everything.
And to what degree was the health support team involved in the story? Like, were the doctors, you know, interviewed or showcased? And
yeah, absolutely. So the video that we had was breaks all the rules in terms of what you should do. It's a 7 or 8 minute video on Facebook, natively uploaded to Facebook, but has gotten about 4 to 5 times the average view length of our typical video that shows up. So yeah, we showed the importance of storytelling and capturing the patient in his home element, you know, getting some of that, but also through the video along the whole way. When he first saw his face in the mirror after 3 weeks after surgery, really a touching moment. I mean, actually, I'm getting goosebumps talking about it right now. It's just a really crazy, great thing. And then just to see how he's able to, the before and after and the difference. We pitched an exclusive to the Associated Press on this too, so it got big traditional media, but the social part of it really enabled him to tell the story without it being super intrusive in his life.
Sure. So changing gears, clearly some good awareness, and Dr. Clark, you talked about now you sort of see a lot of potential of the opportunity. Talking about objections though, besides time, it's a huge element of actually participating, from a physician. What are some of the other, objections that you come across?
Yeah, so it's funny. I was raised by a kind of a more old school doctor. My dad's kind of at the end of his medical career, and when we talk about this, I kind of hear the other perspective, right? So there's concern that that you're kind of bridging a gap that shouldn't be bridged between doctors and patients. That patients kind of only want to see doctors as someone who live in these 4 walls of a clinic or a hospital. But I think as we're moving forward, we're seeing that that's not true. It's good to show that you're a person and you're flawed and you're there and you care for them. Also, there's a lot of concern over HIPAA, over privacy, right? So if a patient approaches you on social media, you still can't, as a physician, you can't kind of give away any information that identifies them or even identifies that they're your patient. So if someone is trolling you, for example, you can't respond back and say, hey, that's not true, that's not what I did in the clinic, because that would violate that trust. So we still have to kind of keep this professional level no matter what comes at us. And then there are other landscapes of this that are still being explored. I don't know. I've tried to look into this, but I think it's still a gray area. Kind of the legal aspect. Does our malpractice cover us on social media? I don't know. And so we have to keep kind of our communications very broad. You certainly can't give any sort of specific medical advice to any patient. You can only answer things in kind of a very broad way or advise people to go to their doc. So there's a lot that we're still exploring, and I think a lot of doctors have those concerns. And the more guidance we can give, I think the more doctors are going to be willing to do this.
So, and Jacob, when you hear that, what comes to mind is, because I'm sure you get all sorts of different objections. Is there anything in addition to that, and then how do you go about, perhaps, communicating and guiding people along?
Yeah, we kind of have this conversation with a lot of our physicians when they first get onto social media or trying to kind of be active online. And I think it's all about setting expectations. If the physician's on there and kind of sharing certain content and not necessarily, diving into, that patient back and forth, I mean, it really becomes a safe interaction. And we always tell physicians it's just like doing a radio interview. You can't see that person. You don't know exactly what's going on. So you need to kind of know to reference, see your physician, and some written sort of statements like that we empower them with, so that they're, always kind of staying on the up and up.
And then in terms of anything that, specifically, prompted a program, Lee, I mean, you've kind of gone about this, you've believed in it, you've had sort of support from your management to, build the infrastructure, but was there any specific milestone or anything that prompted that? I mean, just a similar question to you, Jacob.
Yeah, well, so in 2009, we were talking about this before the panel. One of Dr. Clark's friends is the son of our CEO, okay? And our CEO, or our then incoming CEO, came to us and said, I know we're doing a lot, I know Mayo Clinic's doing a lot in social media already, but have we thought about whether we should do something, make a more strategic investment? And so that was sort of like ding ding, lights coming on, there's opportunities here. Because really fundamentally the case that we've made is that word of mouth is the most important factor in building Mayo Clinic's reputation, and this is the new way that word of mouth happens, so we should be involved there. So that gave us the ability to make an investment and be able to help, really focus on getting our staff and getting Mayo Clinic more aggressively using these tools. But the other thing, because of that history of Dr. Will and Dr. Charlie traveling to, learning from others, teaching others, we said, let's share this with our colleagues in other healthcare institutions too. Let's provide air cover, so to speak, enable, because a lot of people use HIPAA as sort of the garlic or something to keep away the devil of social media. And, HIPAA, you can't do that. And no, you can work through it. And so by the fact that we've been able to work through some of that, it helps provide some, I guess, aid and comfort to those who are other colleagues in healthcare that are interested in doing it. We said we had a day-long program that we instituted in 2011 that we called Social Media Residency, just like medical residency, only 3 years shorter, and you don't stay up all night and nobody yells at you. But it was a way of getting an intense crash course. As that evolved over time, we recognized that we needed to get more advanced with that, and so that's why we created the online certificate part of it that's CME accredited, so it's like legit, and it's like legit. And anyway, that way.
So gangster in that title.
Yeah, exactly. So I'm just thinking of Ant-Man and,
I'm with you.
Yeah, so anyway, here we go. Because it was now legit, because we could then do we could let our physicians, or actually any of our staff, be able to dive in at any time and go through these modules, go through them quickly. They could do it at their own pace. They didn't have to wait for the 3 or 4 times a year all-day course. We've still continued the all-day course, but we don't have to, we can make it much more advanced. We don't have people coming there saying, what's a retweet, what's a hashtag? They have the basics, and then we can think more strategically about how do you build a plan for overall communications that include social.
Yeah, and I think for us, there were several milestones and sort of turning points where we got to this point where we could launch a program like this. A few years ago, we live tweeted a heart transplant. And that probably took about a year of prep with our operations staff and with our legal department, and just kind of making sure everybody understood what this meant. And it was an all hands on deck event when we did it. And that really broke down a lot of the barriers that people had around being more transparent, posting more of these stories through social media. I think kind of the second driver was we actually went through a merger where Baylor Healthcare System merged with Scott and White. That created a situation where we had two really different perspectives on social media and really marketing in general, and a lot of misinformation and a lot of different policies that had come together, and we really needed to create some kind of program to unite everyone and really explain what was possible again. And I think the third sort of driver was we've always taken a lot of pride in bedside manner at Baylor Scott and White, and so thinking about a program like this is kind of a natural extension. I mean, when someone's talking to friends and family, they don't say, I'm seeing Baylor Scott and White for this. They say they're seeing Dr. Smith or Dr. Clark or
Right.
whatever the case might be. So being able to have that personal connection really fit with the way we told our brand story.
So, Lee, Jacob, I know you guys would love to have every doctor be a Dr. Clark, and that she's, light bulbs have gone off, she's starting to participate. Dr. Clark, for you, like how, would you communicate to other doctors of, getting involved, or when you hear those objections, like, do you kind of have some messaging now that you've been, in a little more than perhaps they?
Yeah, I mean, I've been encouraging colleagues of mine who are nervous about it. I think having the program that Jacob has is helpful because it kind of gives you an introduction, kind of gives you baby steps. I mean, it feels weird at first because, I have my personal social media where I'm myself, and then I have this Twitter account now that's associated with Baylor Scott and White, and I haven't quite figured out how to do that right yet. Like, I feel like I'm a dork on Twitter because I'm just like not being myself yet. It's like all medical stuff. So I think just kind of encouraging them that it's a process and that they're there to kind of guide us, and there are ways, just like Lee said, there are workarounds. There's ways to not violate anyone's privacy but still kind of get information out there. And then at the end of the day, we all went into this because we want to help patients, and if this is how we help patients now, then we just need to get on board.
So Lee, Jacob, I mean, these programs are not small. They're, take a lot of people, but they also take a lot of investment. When you go to look for to support these programs, budget-wise, what's top of mind, and how do you communicate how do you build support as far as budget, and then how are you talking about the performance of these programs, or what are you being asked to report on?
Sure. Well, I mean, as I mentioned earlier, word of mouth has been the #1 brand information source for brand support for Mayo Clinic, and so there was a natural getting it, I guess, and understanding that the connection between old-fashioned across the backyard fence, social media, social networking, or networking at medical meetings, that this was just the new way that happened. So we did get, that led to our initial investment. Now we just needed to maintain it, and so part of it is, we can show, increased appointment requests coming from social, and just those connections. And then but at some point it's like it is the price of doing business. That this is the way that people are communicating now, and if you're going to be relevant in the way that they're getting their information, as Dr. Clark said, you need to have them equipped to do it. And just as we invest in training for, infection prevention and other kinds of things, we need to invest in training to help our staff be able to do these too.
Yeah, I think for us, kind of similar to what Lee was saying, it's one of those things that I think we as an organization saw as a need and a sort of a must-do action to start a program like this. We had a lot of physician perspectives. We had some out there doing it kind of Wild West style, and we kind of wanted to bring them into the fold a little bit. And we had others who, had started a Twitter account and never posted anything. We kind of wanted to take advantage of those opportunities. And I think really on the ROI side, the ability to really track and report on all of these interactions that are taking place through a program like this makes it really worthwhile, because we can show the number of visitors that we're driving back to our web properties. We can show the actions those people are taking on our web properties, and really report back some robust analytics that you can't necessarily do with a billboard or a program like that.
And Dr. Clark, it sounds like you feel it's the right thing to do. It's the way that it just makes sense to communicate. is there anything top of mind for you that you're looking to, maybe see or get out of these efforts?
Yeah, I mean, once again, kind of going back to preventative care for me, I would love to just know that I'm reaching patients with the information that I'm trying to get to them. Sometimes when patients are in the office, there's so much going on. People are scared, or just coming to the doctor's office is overwhelming, and so they're not necessarily able to digest everything I'm telling them. So if I can see that I'm having a positive impact on patients, if I can see that they're coming in more readily for their preventative care, or they're feeling more comfortable talking to me about personal stuff because they know I'm a real person, then I would see this as a success.
So, I guess when we talked a little bit about reporting, maybe let's go a layer deeper. I'm sure folks, maybe would be keen like I am. Like, is there any specific, type of data that maybe you don't have now that you'd like to see? I mean, I know, Lee, you're saying, conversions, you're seeing people sign up for, is there a crystal ball, or, from a technology standpoint, is there anything else that you'd like to see that you're not seeing?
Well, we have, it isn't necessarily technology that isn't there yet, but we have great records about people once they become a patient at Mayo Clinic. The connection of, there are some privacy concerns of tying the public data on Facebook and Twitter to the electronic medical record, for sure. So I guess getting a little bit more of that upstream CRM, it's a technology that exists now, and we are implementing CRM, but it isn't as advanced as we'd like it to be. We'll get there, but I think that'll really help us more exhaustively prove the benefits. We can show, I like to use the biopsy analogy, that we say, we know that in certain areas we've done YouTube videos and we've done Facebook campaigns and things like that, and we've seen growth in that practice. And so if you extrapolate a little bit across the other things that we're doing, it's a reasonable argument to make, and it's worked so far, that this continues to be a good investment. But we'll be able to be more exhaustive when we have the CRM more fully implemented.
Yeah, I think for us, we've already seen some early results. We have a lot of active CV in heart physicians, and that's showing up as one of the big traffic drivers into those areas, just because of the activity they're out there doing. I think as far as analytics we're not seeing, not having a collective report of the kind of engagement that they're getting, we kind of have to anecdotally go out and kind of check that out, but we consider that one of the big benefits as well, our physicians being engaged with the communities we serve and having good conversations in addition to driving traffic and things like that.
Sure. Yeah. Well, I'd love to turn it over to the audience for some questions. Maybe just before I do, though, if you guys were to sort of kind of wrap up, if there was a specific next step or message or best practice or key learning that you've had in your endeavors, whether it be Lee, I guess, nearly 10 years into, Jacob a little newer, and then maybe we'll let Dr. Clark have the final forward-thinking thought for us before we turn it over to Q&A.
Well, I guess I'd kind of close this part with just an extension, maybe an amplification of what I'd said earlier, that there's a lot more continuity between old forms of communication and these new digital tools than there's discontinuity. It's the same fundamental principle, but they're power tools. And anytime you're using a power tool, there's a potential to do damage. And so that's why you need the training and the guidelines and consultation to help you do it well. And that's, we found that, but we also have found that the benefits are significant, and that the negatives that people always expect are going to show up are just, because that's where everybody's head just races. They go there right away about, well, it's only going to be the complainers. They're the only ones that are going to be involved, and that's just, we've not found that to be the case.
Yeah, I think for us, we've been running this program really as a pilot for about the last year, and we're just excited to roll it out to more physicians and more areas and get more people involved. We've already seen the program itself had a good effect on getting our physicians online. And when we run into those issues where physicians are resistant and things like that, what we often find most effective is showing them what people are saying about them online, because a lot of these folks have people tweeting about them and just not tagging them. So that's usually a big draw. We also have one of our physicians who has more Facebook fans than we do as a brand. So we usually show them his page, and then they're all very interested in how they can get the same sort of interaction. Yeah. So jealousy is a big driver. as far as the personal motivations. So.
Yeah, I guess, I mean, like I said, I'm still new to this process, but medicine should, in principle, be cutting edge. We should be embracing kind of whatever the newest studies show us is best for our patients. So if that's social media, we just need to kind of step outside, you know, kind of our comfort zone, and we need to embrace it, and there's ways to do it. And I think it's exciting to be kind of at the forefront of that, and we can do it right, and we can make it work for doctors. And I'm just excited to see where we're going to take it.
Excellent. Excellent. So maybe we'll just line up by this microphone here. We got lots of time for Q&A, so go ahead, maybe just say your name, where you're from, and fire away.
Cool. Hi, my name is Melissa, and I work for a local Austin company called Autobach. We're a global company. We make prosthetic limbs for amputees, and we make mobility devices, you know, for children with the cerebral palsy. And we're actually, it's really funny because we're building our social media program now, and we're experiencing a lot of the same things that y'all were talking about. And so I'm kind of curious about the logistical aspects of building your marketing communications team, if that's what you call it in your company, and how do you engage your internal employees to share and spread your message? Like, do you literally have a you know, new hire orientation that now talks about social media and sharing? So that's my question about the logistical process of adding this into your company culture.
Well, I'll just start with that. We have a with our new employee orientation, we've got about a 2-minute video that we've made 2.5-minute video that's part of what we show every employee, letting them know that Mayo Clinic does encourage this. We've got the Mayo Clinic Social Media Network as a resource that they get membership in for free. They get access to the training curriculum that we've created, and that we really want them to be doing it right, that we do have guidelines about how to do it the right way. And yeah, I'll tweet out the link to that so you can see the video, but we actively encourage the new employees to do this.
Yeah, for us, the application we onboarded that we're really rolling out to all employees has been a big help in just kind of showing people that there is, the ability to share this stuff, that you can get training on it. And then, we are also working to incorporate it into orientation so that folks from the very start can kind of understand what they can get out there. We've also partnered with our internal communications team really with what goes through that app. So there's both internal and external communication. So even if you're not socially active, you can still use that application to get, the latest news and know what's going on. And that's been a lot of excitement around that within the system, just kind of getting out of email inboxes and to some other interface.
And maybe just as far as the adoption of the program, the rollout of the program, some things that we've seen best practice-wise at Hootsuite is strong executive buy-in and actually having a few executives to, put their hand up and participate means a lot. So that's something to kind of keep in mind as well.
Hi, my name is Kelly. I'm a social media manager for a company called CompTIA. We do IT certification, and we represent people who work in IT. So not quite healthcare, not nearly as litigious or regulated. But one thing that Lee mentioned that I'd like you all to expound upon, not even 5 years ago, everybody was saying, from vending machine owners all the way up to lawyers, why would I get involved in social media? It's just a space for haters. Are we past that pain point, or is that something that you still have to manage to as you're rolling this out to, I'm sure, an audience that does receive criticism on a regular basis?
Yeah, the answer is 100% yes, we're past it. So most, especially from an enterprise standpoint, so I'll just say, anecdotally at Hootsuite, we are at a point now where the social media team or the PR team or the marketing team, wherever social kind of sits, is now C-suite worthy. So we're seeing that CMOs, CEO are asking about the investments that their team has made. They want to see the ROI, whether that be brand awareness, whether it be driving engagement, driving sales. So, we've not come across, at least, in our experience, in our view, that mentality, thus far. Maybe different markets could be less evolved and mature, but I think that for sure we see North America, United Kingdom, Australia, different spots in Asia Pacific, Middle East, all really starting to take a look seriously at making their investments.
And I think for us too, we kind of built the insurance system, I think, around this before we really launched a program. So we have a pretty robust listening program and a listening center we've actually built out. And so part of kind of activating all of our physicians on social is that we give them sort of the training that we're there as a resource. They can throw things to that team, and they don't need to feel like they're out there alone if they do get a troll or a hater that finds them on social media and they need some assistance with that.
And I would say from a medical perspective, you know, it's already out there. Even before I was kind of engaged in this project, you can Google my name, and there are any number of websites that grade doctors, and we don't have any say in that. I never submitted my name to that. I don't know who's filling out the surveys. Most of them are lovely people, and they're saying lovely things, thank goodness. But, you know, we're already out there. So I think kind of letting physicians know that there's a way to have some sort of control where you're actually, you know, in charge of what your message is and what your profile is. I think that's empowering versus just having your name out there and people can kind of write whatever they want.
Yeah, that's a really important thing. So that's a part of where this training program that we have really helps, because we recommend to our physicians who are concerned about what people are saying about them online, get a Twitter account, get on LinkedIn, claim your profile on Doximity, and then we say go to our training modules and you learn how to do a good Twitter profile, a good LinkedIn profile, so that when people search your name, those are the things that are going to tend to show up higher on the list. It's going to push the ratings and review sites a little further down the list. And it just helps them, you know, sort of practice good hygiene in terms of their online reputation.
Yep.
Hi, my name is Caitlin. I'm a marketing manager for a dental group. We have 15 offices across Phoenix and Denver, and growing. So we have almost 500 employees. And kind of expand on the first question that was asked. So we're kind of the opposite. We have our doctors and orthodontists are on social media, and they use it a lot for their personal use, but we don't get a lot from them sharing the company news and the updates and the pictures and all the events that we do, and we do a lot of content creation. So kind of, I don't know if you guys have any experience like motivating them, or I guess the executive buy-in is definitely a key player there, but we're not really seeing any company updates coming from there or sharing anything that we're sharing on social media from the company pages to their personal pages.
Yeah, some of it goes to how you're asking them to share. So there's some good employee advocacy tools out there, some good mobile technology where you can, instead of sending them an email or asking on a, you know, walking by their desk to share. So there's, you know, technology is one element. I'll, you know, share with you some recommendations there afterwards. But usually we find that there is going to be yes, the executive, but there could even be an initial champion or two. And then if you can kind of find those champions, work with them, shine a bit of a spotlight, eventually connect the dots between what they're sharing to that being a positive impact for the business, then that's another element to consider as well.
Yeah, for us, we really brought the app online because we had situations where we meet with, you know, say a particular service line, we'd show them all the social media stories we told for them over the last 12 months, and a lot of them in the room would say they'd never seen them, and they would have liked to have seen them when they went live. And even though they were following our pages, interacting like via those social networks because of Facebook algorithm and all that kind of stuff, they don't necessarily always see everything we post. So having that app so that they can see, here's the latest story, and kind of filter down to that granular level and make it really easy to share that story, I think it's been a big help as far as just empowering people to get the message out. Because a lot of them wanted to, they just didn't really know how to phrase it, what to post, how to get the link online, things like that.
She kind of asked my question a little bit, but that's okay. Hi, I'm Meredith. I manage the social media channels for Deloitte Global. So while I don't deal with health practitioners, I am working with auditors and consultants on getting them to be active on social, which is a similar challenge. We have a formal employee advocacy program that we've piloted over the last 6 to 7 months. And what we find is that we get a lot of engagement really early on, a lot of excitement to be a part of it. And then we have this sort of hit this plateau and it tapers off. And then they're just not using the tool that we have as much, and our engagement numbers go down until we onboard the next group. And then we see that engagement number go up. But sustaining that engagement has been a challenge for us. And I'm curious if there's any specific incentive that you are implementing you know, to keep that, not necessarily, not get them the buy-in, they're in it, but maintaining that engagement over time? Just curious.
I think for us, I mean, kind of our engagement program, our employee advocacy program, has a pretty robust infrastructure behind it. So when we go out and onboard the program, we also talk a lot about how our story development works for social media, how they can get involved, and we set up a lot of processes that take place offline as far as getting those stories to us and being a part of it. So that there's really kind of, we're still really onboarding a lot of groups, and so they're very interested in getting their stories into the app and being a part of the, you know, the brand news. And I think that's been a big motivator as far as maintaining their interest. I think executive buy-in has been the other really big key piece, because we've made it a part of several, you know, operational meetings that take place throughout the system now. They talk about, you know, what stories they have to tell, what, you know, needs to go into that communication channel. And so it stays top of mind for folks to log in and check in. So that's been, I think, that was some of the big drivers for us.
I'd say it's just kind of natural to have a taper like that, because you're going to have people who are going to try things. Like when we started on Twitter chats, so this was 2008, okay, we were starting to do Twitter chats. We had some physicians that would create a Twitter account for the Twitter chat, and then they wouldn't tweet again, and others would just take off and they would continue to do it. So there's that, you know, 90% that are going to be just lurkers and watchers, and 9% that might just, you know, retweet or comment, and 1% are going to do the original content. You know, I think that's just, it's not exactly a law of nature, but it's pretty close to it. And so I probably wouldn't beat myself up too much about the fact that you don't have 70% of the people continuing being super active in it, because it's just sort of, people have different, they either take off with it or they don't.
And then content as well as one piece. So we've found, like, as we look at rolling out advocacy programs, both internally at Hootsuite and with different customers around the world, is the content creation and what actually goes in the advocacy tools that you would share matters quite a bit. In that, if it's just, did you say Deloitte?
Yes.
Yeah. So if it's just, if it's mostly Deloitte, you know, kind of content, or it's your thought leadership and it's very Deloitte kind of centric, versus perhaps other pieces of information that the employee base would maybe want to share, because there's only so much where it might feel spammy if they're just continuing to share Deloitte stuff, and that you'd need to, you know, have the discussion with your team. But if there's other more regional specific, you know, more newsworthy or entertainment, or, you know, other aspects that the workforce would go to as a source of knowledge, and is a component to it.
Yeah, that's great advice. Thank you.
Hi, I work for Digitas Health. We're a marketing agency that specializes in healthcare brands, and we see a lot of HCP or physician activity on Twitter, especially around conferences and thought leadership. And you've been talking a lot about how doctors use social to communicate in the community and with their patients, and I'm just wondering if that's also something that you plan for them to be talking to their colleagues as well, or if that's something that they're naturally doing on their own.
Yeah, we actually, a lot of the interest from our physicians, especially early, is to get on social media and connect with their colleagues. We have a lot of folks doing research that are very interested in that. We actually have, you know, a whole other sort of channel of our social media program that focuses on that physician-to-physician communication. And I think it's a good way to get them involved early, you know, because the patient interaction does have its limits around HIPAA and privacy concerns and things like that. But we always really push them to try and share more of those links and interact as if their patients are interacting with those accounts as well, because it just improves sort of the collective intelligence of the patient population as well as their fellow physicians, if they can sort of share what they're reading, what they're interested in, and in addition to just what they're doing and connecting with colleagues.
Yeah, we'll very quickly or very frequently before a major medical meeting hold a brown bag session with some of the physicians with the departments to introduce them to Twitter if they aren't familiar with it. Because part of what you need to do is get that feedback that shows, wow, you really can make connections with people using a conference hashtag that you would have never met otherwise. You know, and when they see that serendipitous kind of outcome, that causes them to get hooked a little bit more. So.
Yeah, for me, that's a huge incentive of it. Medicine, you know, we should be sharing knowledge with each other. We should be sharing best practices, and that's that's a big part of medicine, is kind of meeting up with other docs and saying, you know, what's your take on this, or have you read this new study? So the idea of being able to kind of reach colleagues that way, see what they're working on, that to me is one of the biggest incentives to do this.
Lee, are there any hashtags that you think, you know, just good sort of healthcare hashtags? That
Yeah, hashtag MedEd, hashtag HCLDR, you know, the HCSM is another great one. But I mean, healthcare is great. The simpler the healthcare hashtag project that's out there, you know, somebody's going to tweet this, I know, right? So it's, I mean, it's this comprehensive list of conference hashtags as well as disease-related ones. So whether you're interacting with professionals or e-patients, that's a great resource.
Hi, I'm Felice, and I work for Amada Health, which provides behavioral counseling to help people reduce their risk for diabetes or heart disease. And so our users could be your patients, and they could also be employees of a healthcare provider. You had a slide that showed some of the stats that HR leaders care about, and I'm really curious to know more about how or whether digital marketing or social media has helped spread the word about internal initiatives, whether it's a quality initiative or an initiative for employee health and wellness.
Yeah, we've actually seen, even before we started the employee advocacy program, when we share a story via our social media accounts, it sometimes can reach more employees than our traditional internal channels did. You know, there's a lot of employees that don't necessarily get to the internet every day or get to their email. And, you know, we have a large population of employees that are on their feet and don't have a dedicated sort of computer console throughout the day. So I think social media has kind of become a partnership with us and our internal group that does internal communications, just because we know that sort of power to get that story out there more broadly.
We have a WordPress-based, and so we use the community they have. Our Mayo Clinic social media network is a WordPress-based community where we have accounts that are set up as, you know, individuals. So part of the idea with this is that we wanted to have our own space instead of just sharecropping on Facebook. And so what's been fun with this is we've been able to clone the social media network site to be the patient-to-patient community site, then also to be a journalist site, you know, just reaching different audiences. The exciting project we have now is that our intranet news center will be moving outside the firewall and will be allowing, so we're working out the logistics of it, but the basic idea then is that we'll be able to have, because we'd have great stories published on the internet that nobody could share because it was the firewall in place. So, so having the employee news center, and most of the stories would be okay for sharing anyway, so why not put it outside the firewall and then just lock down the ones that are limited to or should be more confidential.
And maybe one piece I'll add too. So our CEO Ryan Holmes, probably about half a year ago, there was feedback that, so we have about 900 employees in 12 different offices around the world, and the further you were away from Vancouver, the less connected you felt to what was going on at headquarters. And so every Friday morning, Ryan does could be as short as 3 minutes, it's never longer than 7 minutes, and it's a CEO update of different things going around. It's completely internal and confidential. We use Workplace by Facebook, and we've seen tremendous net promoter growth score. We've seen, you know, all of the survey data that we do, people now feel much more connected, and that was, you know, it takes him 10 minutes a week, and it's really, you know, driven some fantastic HR, you know, results. So, yeah.
Hi there. I helped, I work at Dignity Health. It's a large healthcare system on the West Coast, and I've been leading their social media for the last couple of years. So I know we've been talking about doctors, but we have a 60,000 workforce number, and really, you know, not that it's a problem, but our staff is more of the type of folks that we have to constantly watch, right? And you know, everyone's gotten much better at it, but is there anything that you've put into place to help them learn as well, right? Does that course that you've put together for doctors also apply to nurses, to staff, to facility, you know, keepers, things like that? Because to the point of, the description of this, a large percentage of our social media engagement does come around the workforce, right? And they love just organically sharing our stuff all the time. And then their network, right? But it's one of those things that sometimes we get tons of inappropriate, right, HIPAA-related things where they're like, look at this baby that, and you're like, you can't, right? And
Does that really happen a lot?
A lot, no, but enough that
Yeah,
it's,
I mean, and that's the thing, so first of all, our course is for all employees. It's not just for doctors. We just went for the CME accreditation so that it would be legit. But beyond that, we really do the outreach to to our staff. Our HR group says, social media isn't appreciably different. I mean, there's this rampant problem with employees sharing what they shouldn't. I mean, and the good news is that employees are friends with each other, and they're likely to not rat each other out, but they're likely to, go, counsel or, say, hey, maybe you really shouldn't be saying that, or, they provide that good reinforcement. 20% of our staff are nurses. We've got a significant initiative with our nursing staff too, because we see them as, they're the people that are front lines, making our reputation with our patients. But we tell them the most important thing they need to do is provide care in a way that makes the patients post on Facebook versus posting on Facebook themselves. We want to encourage them to do that, but they need to still provide that high level of care.
Yeah, for us, similar to Lee, our program's open to really all employees. So we have executives taking administration staff, physicians, and nurses, and we don't really see too much of that. There's the rare case where something happens and somebody shares something they shouldn't have, but we actually see probably more often than that people kind of ratting on each other. Somebody says, I don't know that this is okay, and send it in, and we're like, yeah, that's totally fine. We kind of have to talk them down because they get very excited about it. But I think one thing too that's really just made this people more aware of it is through our listing center. We're monitoring Facebook reviews and reviews that are out there, and whenever one of our employees is mentioned by name, we route that back to that employee, especially if it's a positive mention. And so they really know there's this back channel, and they're aware of the environment that's happening around them. And I think it's made all of our employees really take that into consideration when they're out there. I mean, we had one recently where someone listed probably 22 staff members that touched them while they were in the hospital. They must have had a sign-in sheet the entire time they were there. But everybody got a really big kick out of seeing that shared, and I think it's creating more of a positive reinforcement environment around social than the sort of negative, we're watching you, be careful there kind of thing.
Time for one more question.
Hi, I'm Jennifer Bosley with Vizient, and we are a consulting group and work with hospitals all over the country. I have a question about the content that's generated throughout the social media. Is there any kind of sentiment analysis happening to improve patient satisfaction, or is that part of the plan at all, or strategy?
So we have a listing program that kind of does a lot of that for us. So we actually monitor everything said about our different brands throughout the system, as well as Yelp reviews, Facebook reviews, Google reviews, really the whole 9 yards. And we have a report that goes out monthly to each of our hospitals to let them know kind of where they stand. So we kind of have that channel set up really before we even launch the advocacy program. So we know as soon as there's any sort of negative sentiment situation happening, even if it's one of our physicians in kind of a Twitter chat off away from what the official brand might be saying.
We also have a listening program where we listen for mentions of Mayo Clinic and mentions of what would be called in other industries competitors, but they're peers. Okay, so we're looking at relative buzz and things like that, and tone and sentiment. I mean, the big part that we're looking for is for early warning of a significant issue, and to be able to respond and do the service recovery if necessary. We find that it's highly positive to neutral, and that it's really pretty unusual that it's a negative mention, but we want to be able to deal with them when they are.
Thank you.
Well, please join me in thanking Dr. Clark, Jacob, and Lee for today's panel. And thank you.